Right now, there are an estimated 25 million Americans who experience chronic pain every day. Chronic pain, as we know, can be debilitating, can take over a person's life, leaving them desperate for any type of relief. And often the answer, it's pain medication. But what then happens when that medication takes over your life? Our next guest, Kathy, knows this story all too well.
About 15 years ago, I started having severe back pain, and I went to my private medical doctor. It was a full-blown degenerative disc disease, and he gave me pain medications and started me on epidural injections. When they didn't work any longer, they started prescribing me a really strong opioid. They had also added on a muscle relaxant. It got to a point where they were giving so much that they couldn't give any more of it. And then they started me on fentanyl patches. Pretty soon, the pain medication was becoming less and less effective. My body would get used to it, and I ended up on high doses of fentanyl, 150 micrograms every other day, enough to kill an elephant. It was debilitating. I wasn't able to drive, I wasn't able to work, I was in bed all the time. I was grumpy all the time. My relationships suffered. I was literally addicted to the fentanyl.
Kathy is joining us in our audience today. Kathy, you were able to turn things around.
Yeah, fortunately for me, I had a fantastic physician, and I trusted him and went with his advice.
And her physician sitting next to her is Dr. Chaz Bono, and you are an interventional pain management specialist and figure out unique ways to get people's pain under control, because the first choice shouldn't be, okay, let's just do opiates, let's do opiates. Okay. You use something somewhat unique with Kathy. Tell us about that.
So with every pain patient, you have to look at the 4 different types of treatments that we can offer them. There's exercise and physical therapy, which has proven to be very helpful. Low-dose medications may help certain patients, but we now know that high-dose medications are not the right way to go for these patients. Epidural injections can help, but they can help immensely, but they only last for a few weeks to a few months at a time. Then there's the surgical option with spinal cord stimulation. And with the new technology with spinal cord stimulation, we were able to try it for Kathy. Kathy loved it, and she underwent an implantation. And since then, she's been able to reduce and discontinue all her pain medications, and she's doing fantastic.
Yeah, I'm off of, yeah.
Well, and I think the difference here, and think about this at home, if you're suffering from pain, there's a difference between masking the pain and actually treating the root cause of the pain, whether it be through, like you said, physical therapy or something like this. This spinal cord stimulator, a little bit different. How so? I
think everyone needs to understand that spinal cord stimulation has been around for about 45 years. But traditional devices caused a tingling sensation across the patient's back and into their legs, which would in turn mask the pain signal. This new technology called HF10 doesn't have any tingling associated with it at all. The patients eventually start to have pain relief after the implantation, and as they turn the system off, the pain slowly comes back. They get a remote control in order to be able to choose from different programs, and they can turn it on or off. But most patients don't even do that because it's seamless therapy. They keep it on 24 hours a day, 7 days a week. They sleep better at night, and they function better during the day. It's been a life-changing experience for a lot of my patients. And we knew that Kathy would be a good candidate for this type of therapy. At the beginning, she hesitated a bit, but eventually she decided to have a trial, which is one of the best things about this device. The patients get to have a trial first for about a week to see if they like it or not. And the trial takes about 15 minutes in the operating room, and it's outpatient. She tried it, she loved it. She came back and we implanted the device for her over a 45-minute surgery, and it's also outpatient. And the device is good for 10 years. And all she needs to do is to charge it for about 30 to 40 minutes every day, and that's it.
Right now, Kathy, what does it feel like, if anything?
I don't have any kind of feeling or pain or anything.
And I think the answer for people out there watching who may be in chronic pain on chronic opiates is to work with a pain management specialist who does utilize alternative techniques, who isn't just going to snow you with more and more medications, because that is never the long-term answer. Kathy, so happy that you had this result. And Doc, thanks so much for sharing it with us.